Good afternoon, everyone. We're very excited about hosting this webinar, and hopefully everyone can get some very valuable information from this and be able to take some of this back to your practice day today. So good afternoon. Hello, and thank you all for joining us today. And this is our SRC Accredited Master Surgeons in Robotic Surgery. We're advancing robotic surgery with SRC Accreditation today. We're very excited to be here with you all. My name is Sue Hansen. I'm a senior quality inspector with SRC. I am a nurse. I have my master's in nursing and have a very high focus in the surgical services, specifically the robotic arena. So this webinar is of particular interest to me and a very special importance to me today. I am pleased to be monitoring and moderating today's discussion. Before we get started, just a couple of highlights on the agenda. There is a Q&A tab where you can submit questions at any point throughout the webinar, and we have saved some time today at the end of the webinar to answer these questions. We do have some slides that will correspond during today's webinar, but first I'd just like to start off with a little bit of a brief overview of Surgical Review Corps. Again, this is the Advancing Robotic Surgery with SRC Accreditation today, strengthening our robotic programs. We want to improve patient outcomes and drive quality and growth through patient care. We have completed our introduction, just a little bit about SRC and some background for those of you who have joined today. We are a nonprofit global healthcare leader driving quality improvement and advancing patient safety with our more than 40+ accreditation programs. Working to raise the bar on healthcare standards around the world, SRC accredits with leading providers and facilities that have proven excellence in patient care and quality outcomes through achieving centers of excellence, as well as master surgeons. With over 20 years dedicated to elevating healthcare, SRC is partnered with thousands of providers across more than 27 countries, ensuring patients everywhere receive the best possible care. I am pleased to be joining today in our discussion today with two accomplished SRC Master Surgeons who work both within the gynecologic field. First, we have Dr. Nikolaos Plevris from Attiki, Greece, and Dr. Asulin from New Jersey. Unfortunately, Dr. Sharif was unable to join today due to unforeseen circumstances, but I am very excited to have representation both within the United States and outside the United States as we talk about advancing robotic centers of excellence today. Just a little bit of background with regards to our master surgeons. First, I'd like to introduce Dr. Nikolaos Plevris. Dr. Plevris is focused on enhancing surgical outcomes in women's health care in Greece, where he's the director of gynecology department at the Metropolitan General Hospital in Greece. Additionally, I'd like to introduce Dr. Asulin. He's a pioneer and leader in minimally invasive surgical techniques and one of the world's most experienced gynecologic robotic surgeons. He has taught extensively in the area of minimally invasive surgery and trained a large number of surgeons using the robotic surgery technology and techniques. He is a board-certified obstetrician, gynecologist, and a fellow of the American College of Surgeons. Currently the chief of the Institute for Robotic Surgery at Hudson Regional University Hospital, as well as the director of the Gynecologic Robotic Surgery at Pascack Valley Hospital in Westford, New Jersey. Dr. Asulin also serves as the head of the Center of Endometriosis Medicine. He's accredited by Surgical Review Corps as the first elite master surgeon in gynecologic robotic surgery. So we are very pleased to have both of our master surgeons and experts here as a resource today to have this discussion move further with regard to Center of Excellence in Robotic Surgery. We do have a series of questions, but before we get started, I'd like to offer the podium to Dr. Plevris very quickly with regards to an introduction, and then we'll turn it to Dr. Asulin, and then we'll go through some questions. Dr. Plevris?
So, Sue, thank you. I would like to thank SRC for the invitation. It's my privilege to talk in this webinar together with Dr. Asulin. So I've been with you for the last 2 years. So I got accredited as Master Surgeon back in 2023. Back at that time, robotic surgery in gynecology in Greece was at its beginning, not even to discuss about quality assurance and how surgeons thought about seeking quality metrics during their work. No matter how we indulged into this process, and from the beginning, SRC was on our side. So neck to neck daily work and quality assurance made huge progress in our business plan as far as robotic surgery and gynecology is concerned. So a huge thanks to you and looking forward towards discussion.
Thank you, Dr. Plevris. We really, really, really appreciate your time. Dr. Asulin, I'd like to offer you the podium for just a moment for introduction as well.
Well, thank you, Sue. Thank you for beautiful presentation and introduction. I'm humbled. I'm honored to be here. And you covered pretty much my story for the past 20 years when it comes to my work, surgical work in GYN, Urogyn. I do want to just, highlight a few points, not about myself, rather talking about what SRC has done and my involvement with SRC. I do take pride in the fact that I've been involved with SRC from the very, very beginning. I stopped counting the number of centers that I directed and was able to accredit with SRC. I think it's over 8 or 9 of them by now. I do see the value. I believe in the value that SRC can provide in advancing mainstream work, elevating the quality of work, maintaining some sort of consistency and reproducibility with our work. So there's so much great points to discuss and highlight, and I think we're going to talk about some of these points as we go along. But thank you again for the introduction. It is my honor and privilege sharing whatever I can with you. Thank you, Sue.
You're most welcome, and we here at SRC are very grateful for each one of you, and has been a wonderful partnership advancing your centers of excellence throughout the years. So thank you for being here today. I'm going to go ahead and dive right into some of our questions. I'm going to direct the first one for Dr. Plevris' response. Robotic surgery is transforming healthcare. In what ways has it enhanced your specialty or changed how you approach surgery?
So throughout our practice, we're committed to delivering high-level care to women, but obviously always with the cornerstone of safety. So we had to prove, especially in a country that robotic surgery didn't exist in gynecology, and minimal invasive surgery through laparoscopy hadn't exceeded like more than 15% of the total of cases done in the whole country, that we can have a consistent workflow and a low level of complications, while we needed to prove that we could optimize our surgical time and achievements. In that way, we have published recently our work that shows exactly that the more all the facility and the team that works with us gets more familiar with the rhythm and the way we operate, the more difficult cases we can treat throughout the spectrum of benign and malignant cases. And in fact, nowadays, we have shown that through robotic surgery, we can keep our complications level lower than laparoscopic or open surgery, and at the same time, help patients get home safer and faster. This was the cornerstone of our work, and this proves that robotic surgery has added to better living of women and quicker return to their everyday life. I think quality, as SRC proves, is the cornerstone of robotic surgery as well. Less pain, better life, achieved through low complications and consistent in our work.
Diving a little bit deeper into this question, I'm going to ask Dr. Asulin for your response. With regards to robotic surgery, Dr. Asulin, how has robotic surgery transformed and enabled you to perform procedures that were previously too risky or complex?
Yeah. It's a great question. I'm going to fast rewind to the very beginning of minimally invasive surgery within GYN work. The process went from doing open cases to progressing to vaginal cases and then laparoscopic cases. And we were fairly limited, back in the day with laparoscopic surgery, doing complex cases. Fairly difficult when it comes to articulating instruments and accessing challenging sites within the pelvic cavity. Robotic surgery was introduced, under 20 years ago, and I can tell you I was there from the very beginning. Took part in proctoring and training surgeons throughout the country. I've seen the progression of systems from the very first Da Vinci Model S. I don't know, you guys, it's old for you guys. You guys were in high school maybe back then, but I do recall the very early cases, and I could tell immediately I became a believer from day one. I became a believer in what the robotic surgery specifically, and I'm going to focus on Da Vinci. Whenever I speak of robotic surgery, I'm going to refer to Da Vinci robotic surgical system. It allowed us to complete very difficult cases as far as difficult pelvises and multiple surgeries in the past, creating lots of adhesions and difficult anatomy to access. Robotic surgery since the very beginning has really transformed the way we do things in the OR as far as GYN surgery. In the very beginning, we kind of, allocated cases to the not so complex cases, but very quickly I realized that it's exactly the opposite. And robotic surgery was designed to address the difficult cases. So speaking of transforming the way we do things in the OR with GYN and urogyne surgery, robotic technology allows us to do cases that otherwise we could not complete in a minimally invasive approach. I'm not going to bore you with a lot of tons of the positive, aspects of what robotic surgery does and minimally invasive surgery in general, such as quick recovery, minimal blood loss. You can argue outcome. There are many papers, lots of data showing definite benefit in doing cases the robotic approach. But it definitely allows us to do the most complex of cases robotically. I've done many thousands of robotic cases, and I can tell you that I get more excited the more complex the case is when I sit down and do it robotically. So it definitely allows us to attack difficult, challenging cases within endometriosis, large uterine, fibroids and whatnot, challenging anatomy, and doing it in a very, very meticulous, precise way with minimal blood loss and very excellent outcome. I hope I covered much, but I did want to talk about the progression and what it does today in a world of GYN and urogyne surgery.
I agree. I appreciate that. Yeah.
May I add to that? I agree completely. And in fact, there used to be some cutoff points where someone would say that someone is a candidate for minimal invasive surgery rather than open surgery. And I think this cutoff points, like, if you have a fibroid bigger than 10 centimeters, then you need to have an open surgery. Where nowadays, through robotic surgery, these cutoff levels do not really exist. Having the experience, know where to place your trocars, knowing your patient habitus, these cutoffs really don't exist, and this helps patients, in fact, more women, to benefit from the minimal invasive surgery and all the benefits that it has.
Thank you both for diving a little bit deeper and giving a little bit more background on being able to tackle complex and just the types of cases. Just tagging on to with regards to robotics, have either one of you noticed in your practices, how are patients responding to the idea of robots being part of their surgery? Do you encounter any skepticism or more enthusiasm, or a little bit of both? Dr. Asulin, I'll let you answer that first, and then Dr. Plevris to follow.
Again, I'm a historical guy, and if you look at the pendulum here, in the very beginning, there was a lot of skepticism, and I would say that was, a natural response to patient to new technology. And what actually led to a lot of skepticism in the early days were some difficult cases with not so great outcome here in the US, and some challenges that came as a product of some reported cases that did not go very well. I can tell you that the pendulum moved towards absolute enthusiasm, and people are extremely happy. I can tell you, I did 2 cases this morning, and one of the patients that I did, just to give you an example, is somebody who had about 7 prior open surgeries for large uterine fibroids, and she came to the operating room today, and she was so excited when we first came in, and I found it a little bit strange because here's somebody who's going into the OR number 8. That's my first surgery with her and the first robotic. And I can tell you, she had a uterine fibroid that went all the way up to a xiphoid process. The belly was full of fibroids, and we did that robotically. And I could see why the enthusiasm here, because all her prior surgeries, she stayed in the hospital for a week, 10 days, and complicated, post-op care and whatnot. And she's going to go home tomorrow. She's going to go home tomorrow with very little tiny incisions on the belly. So the pendulum definitely has moved towards enthusiasm. People can see the value, and we are seeing that growing by the day as the technology advances and as more data and more education towards patients. And I can tell you more so as surgeons and gynecologists are buying in and training and doing more work. It's a movement, and it's definitely moving in the right direction.
That's so enthusiastic, and it's really exciting to hear that. Dr. Plevris, can you go ahead and elaborate a little bit more about addressing misconceptions with robotic surgery and kind of your trend and what you've brought to Greece?
Yeah, I mean, I agree completely. There is a whole movement that I believe in a few years, or all traditional laparoscopic towers will be on the side, and somehow more and more robotic systems will be in our ORs. So when I started, by that time, there were lots of patients that had one or more relatives that had had a urological robotic surgery at that point. So because in Greece, I mean, robotic surgery didn't start like 2004 when it started in the US, but back in 2014, 15, spread a lot within the population. There were lots of patients that had already a relative that had experienced robotic surgery. So it was somehow easier to discuss about it. The fact is that we had some issues in the beginning as financing is concerned. However, the small amount of complications, the length of stay, that's almost 99.9% overnight. The fastness to which people go back to work means that in the macroeconomic, patients benefit as far as their financial support is concerned. So there was some skepticism in the beginning, but in fact, the word of mouth is our advertisement. The more complex the case gets, it's funny, but in most cases, the most obese patient that had, that difficult lymph node removed are the ones that you see walking in the corridor that afternoon. So usually they do really well when they during the recovery period, and it's mostly uneventful. The thing that at some time you get some skepticism is that in Europe, the more of the accreditation process is usually state-based. So when we came to say that, there is a private brand that makes quality assurance, and we're looking towards that, it was like, so you're getting to pay in order to get an accreditation. But when we came to see the whole curriculum, the whole process of SRC, the way we teach the patients, the way we teach the staff, the database that you're looking for in order to give the accreditation, the demanding and deeply constructive process of the SRC, the skepticism and towards SRC has turned to enthusiasm as it turns towards robotic surgery as well.
Well, I appreciate that segue, as we've just talked about the benefits of robotic surgery and how it does streamline patient care with optimal outcomes. I'd like to ask, and we'll have you, Dr. Plevris, respond first. What made you and your team want to pursue the SRC Robotic Center of Excellence?
So the way we want to approach treating patients, we would like basically to have a 360 approach of that, meaning that we would like to have accreditations. So we have done, every member of our team has been accredited, has done fellowships, and is part of European and national scientific committees. We're based on the experience. So we work always with the same experienced anesthesiologist, the same experienced scrub nurse. And as part of our 360 way of treating our services, we've got an academic part. So we run our own scientific workshops through which we teach other gynecologists and other surgeons. We ask them to come towards our surgeries and observe. We want to spread the word of robotic surgery through training and mentoring. We're running our own workshop. It's called RCGA. It's called Robotic Surgical Excellence in Gynecology. It's an advanced workshop with lots of hands-on time on it, and it's very renowned throughout Greece and the Southeastern Europe. So part of this 360 process is quality assurance as well. So we want experience, we want the academic part, we want accreditations, and we want high quality and high patient safety. And we were taught through SRC, and we're doing a follow-up on our patients. So after they leave, we call them back in 2, 4, and 6 weeks to see how they do. And the best feedback, is from those patients that don't have, the social infrastructure, and even the fact that you give them a call back and ask them how they do. It's a huge relief and adds to the quality levels that we want to offer. So SRC, it's the cornerstone of a 360 degree service that we want to offer through minimal invasive surgery and gynecologic robotic surgery in Greece.
Dr. Asulin, to tag on with regards to the quality and the value of your accreditation, once you achieved accreditation, what changes did you notice within your program, whether it was efficiency, training of your team, or patient outcomes that you noticed?
If you go back to why, I decided to get involved with SRC and why my team or multiple teams at the various hospitals that I led the programs in. Again, I'll mention that I was there from the very beginning of SRC, and so I was part of the vision. And I think that's what I have to add to, what drove you guys at SRC to accredit as many programs and increase excellence and increase efficiency and safety. I felt that this was a new technology. In the very beginning, the concept of an accreditation for robotic surgery, which is nothing but a tool, it's not a specialty. Robotic surgery is a tool that we have in the OR. And that tool can apply to multiple specialties. And I'll speak of GYN and Urogyn right now, but it does apply to all other specialties. The tool was designed to mainstream and to somewhat provide some sort of a standard, I'm careful with my words, but standard of care when it comes to robotic surgery. And if you break it down and dissect into the actual process and the application, we're talking about pathways. We're talking about here is how we do things, and we're going to repeat things and do things over and over and over again. And I can tell you, repetition makes perfect. So I think what drove me is to create some sort of a Bible, some sort of a pathway for my surgeons in my hospitals to follow a path. And I think that when you're showing a strong, successful program, that could be duplicated to another program and another program. So SRC is a tool. I see SRC as a tool in a way to kind of guide programs to formalize and to have some sort of a structure in place. And that structure will force repetition, efficiency, safety, and you can dive into cost. You can dive into expansions, marketing of a program. So it's the engine that can make a program grow within the GYN world, but I think, again, that applies to all other specialties. I hope I covered the point that I wanted to highlight here.
I think you did.
is an amazing tool that can be used by many hospitals that do have the services but don't have some sort of a common a cookbook, if you may, as to how to approach peri-op and intra-op and marketing and cost and efficiency, and I can make a long list.
Understandable. And just tagging on to the fact that you're talking about your pathways, SRC accreditation places a strong emphasis on data and measurable results with quality. How have you, Dr. Asulin, used your program's data to demonstrate improvements or to justify continuous investment in robotics?
Gosh, I don't think we have enough time to get a full question. I want to try. I want to try and really condense this into a few sentences, but I can tell you that at every single program, and I can tell you a long story about every program that I started in the US, and there were close to 10 programs, and I can attribute the success, and for that matter, for the lack of success when we did not follow PATH and did not follow SRC accreditation. But the success was translating into growth as far as volume, translated into growth as far as training properly. Thank you very much. Training surgeons properly, raising awareness. In fact, we utilized SRC for marketing programs, growing the number of patients that chose to come in and have robotic surgery at accreditation. Again, it is a logo on a front wall of every lobby hospital that I work in with a big center of excellence, and that carries a lot of weight, especially when you can back it up. I can tell you that this will continue to grow, and just like AI, the more you feed it, the more you're going to benefit from it. I think that SRC accreditation is something that keeps on giving. We look at quality, we look at OR time, we look at, overall efficiency, we look at readmission rate, we look at, many factors within surgery that we're able to, again, tabulate and look at trends and make changes and improve on our work. SRC is the tool that we use for that. It is actually exciting to see how it's transforming a program that we've accredited many years ago, and yet we're taking all new approaches, utilizing, again, SRC tools that you have available for us.
Thank you, Dr. Asulin. Dr. Plevris, with regards to utilizing the quality improvement database and looking at your outcomes, analyzing those outcomes to generate improvement, what specifically have you noticed improvement with your SRC accreditation utilizing that quality database?
The thing is that when you look upon data, you can make assumptions as far as the way you use the different resources that they're being given you by the hospital. And when we're talking about a private sector, all these resources are translated to money. And obviously, at the end of the day, this is that will keep you on running according to your CEOs, because they're not surgeons, they're not doctors. So taking into consideration all the assumptions that we made, the turnover time, the anesthetic time, keeping data about every single instrument we use during the procedure, we ended up being able to do 5 to 6 cases per day and finish by 6 p.m. And we're talking about simple and complex cases. So we made it up our algorithms and found out that we can keep stable turnover times, but we can keep on running. And obviously, that the most costly thing in the hospital is the hourly rate of theater. So basically, by keeping not only our complications low, but in fact doing lots of cases per day and high-intensive case days is what SRC accreditation helped us, and that those data were in benefit for our patient and us. And the whole consensus of keeping those data kept our readmission rates low, because in fact, if you keep in mind that we're not only training the staff, we're not only training the surgeons and the rest of the team, SRC insists in training the patients and gives really, really high importance on that, on how the patients get discharged, on whether they get proper instructions or not. And this is a way to reduce even, the time we spend over the phone, or, how our patients go home if they're happy or not. So high intensive days and happy patients are two things that SRC data has helped us with.
That's wonderful. And tagging on to that from an operational standpoint, Dr. Asulin, what has been the biggest economic or efficiency impacts of adopting your robotic systems and utilizing the quality data?
Well, I can tell you that we have already touched on, efficiency in the OR and growing the volume and attracting, new surgeons and, having some sort of a set pathway to expand volume. I can tell you, and I'd like to raise another point here that actually is a link to to your question a second ago. I want to talk about nursing, and I want to talk about the peri-op care. So SRC following the pathways and doing things efficiently and looking at data and following trends and making changes to improve, cutting cost and increasing volume while maintaining quality of care. It did change other areas in a hospital now, and I'll be very specific discussing nurses. At every program that I was ever involved with, I pulled in the nursing staff, and I pulled in the med-surg nurses, ICU nurses, the PACU nurses, all became part of the program, and I actually put together pathways for them as well. So I can tell you that the value and the improvement pretty much touched on every aspect. On the nursing end, I could see a huge improvement, and that led again to, better outcome and more efficient, efficiency in the OR and whatnot. The list goes on, and I think we just covered most of the important aspect that we see great improvement. Nursing, peri-op care, outcome of surgeries, all leads to increased volumes. And I can tell you the suits and the CEOs in the hospital do love that, and they buy in as soon as they see how you're translating excellence in the OR, excellence of a program into financial gain of the hospital.
Yeah, I think you brought up some very important points operationally, as well as the efficiency and the expense piece of it, all kind of bundles together. For hospitals or programs just beginning the robotic journey, would you recommend pursuing SRC accreditation early on? Yes, why or why not? Dr. Asulin.
God, I think you know my answer to that. I think that any program, any hospital who invests in a robotic surgical system, and that is millions of dollars and change in infrastructure and change in mindset, change in, the way we do things in the OR, having dedicated room to robotic program. It's a big commitment for the hospital. Any hospital who takes this step and does make the investment and makes the commitment to get into robotic surgery, the lack of some sort of an accreditation, such as SRC, actually is holding you back and actually will, in my opinion, not maximize the benefit in having such a program and really transforming the hospital or the OR into utilizing robotic technology. So the answer is earlier on, I think it should be one of the first steps. I think it should go hand in hand with acquiring the technology, because doing that, you are pretty much buying a robotic system along with a cookbook and a pathway to show you what to do from the very beginning. Because not having that a program, if you may, a guide as to how to grow a program and keep it safe and efficient and whatnot, you'll get there perhaps, but you'll have to spend double the amount of time and not be as efficient. So absolutely yes, and absolutely not only yes, but do it in a very, very early stages.
Well, thank you for that. I do believe early intervention does promote the best outcomes. It looks like we've lost Dr. Plurvis. He is trying to get back on. So I'm going to continue with you, Dr. Asulin,
Sure.
if you're amenable. I have a question from the group here. Looking ahead, what advancements or trends in robotic surgery are you most excited to see in the next 3 to 5 years?
It's a loaded question. I'll tell you and again, you have the benefit of hearing from a person that have seen the transformation within the field from the very beginning, and I can tell you the changes were huge from the very beginning with every new system, with every new robotic system that came out. We could see more and more improvements. I can tell you that the future is so much brighter simply because we have competition now. For many, many years, Intuitive Surgical, the maker of the Da Vinci robotic system, pretty much led the way. It was a monopoly. They sang and everybody danced, to their music. They released technology at their speed. I can tell you now that there are great systems, that are coming out. There is a Medtronic system that's an incredible system called the Hugo, and other systems in the works. And I think competition would lead advancement. Where do we see advancements? If you look at the very early systems, the early generation surgical systems, and compare them to the system today, you can see that the instruments are still articulating. The ability to look at the anatomy and to access difficult areas within the abdomen or the pelvis is still there. The instruments are much more refined and more precise. They're utilizing more and more AI now to enable surgeons to make changes and to improve as they go along. They are enabling instruments with tactile feedback, something we did not have before. And I can tell you, with all these advancements and added awareness and education and patients being aware, it's going to flow onto areas that we did not use robotic technology in the past, and now everybody's jumping in. You can see the robotic technology going to general surgery, cardiothoracic, colorectal, GYN, cardiac surgery. I think we are at the very early stages. I think that the changes, technologically speaking, are enormous, but we are there. We have the instruments and we have the systems to perform the most complex of cases in today's technology. The future changes that you're going to see are more on a software end, on an AI end, on a utilization of information to improve outcome or to improve the ability of surgeon to do certain things. So the future is bright. The future is bright technologically, but also as the technology spills over to other specialties in the OR.
I think that was beautifully said. There are, as you said, many different robotic versions that are coming out, but I believe in as you said, the standardization of practice, achieving center of excellence early on is going to help you to develop a very successful program, robotic program at any of the institutions. This is the time, the last few 10 minutes of our webinar, to be sensitive to everyone's time, in which we're going to go ahead and ask bring forward some questions and ask for answers. Again, still waiting on Dr. Plevris or Dr. Asulin. You are going to be our lovely response to these questions. First question that I have in the deck says, I definitely see how robotic surgery and minimally invasive surgery benefits patients, but does it also provide large benefits to the surgeon?
Great question. Absolutely. I'm not a young guy anymore. I'm not that old. I'm not that young, and I can tell you that, in the early days, being in the OR, for 10 hours, 12 hours, I would go home and I was exhausted physically and mentally. I can tell you that the great benefit of sitting down in front of a surgeon's console and doing challenging cases. And I regularly, every week, actually a couple of days a week, I'm in the operating room oftentimes until 1, 2 o'clock in the morning from early morning hours over to, sometimes more than 12 hours, 14 hours operating. The robotic technology allows me to do things with less fatigue. I have better access, I have better visibility, I have better technology to perform the same steps I can perform with an open abdomen. But really, again, you're seeing more and more advancements and benefits is AI. And I'm going to keep on mentioning AI here because the data, the real-time data from surgery is transmitted, and the surgeon can see what they're doing wrong or what they can do better and therefore improve. You don't have that when you do open surgery. You don't have that when you do laparoscopic surgery. So quality, ability to perform complex cases, less fatigue, incredible visibility with high definition, instruments and optics, and instruments that are just incredibly precise and articulating, pretty much accomplishing any case that I would otherwise do open.
Thank you. An additional question again to you, Dr. Asulin. When you first started robotic surgery, did you encounter any barriers to colleagues adopting this new technology, and how did you handle that?
Well, just like everything else, as surgeons can be fairly challenging sometimes, and pretty set, in their minds as to how they do things, how they train to do things. Change is difficult. Many surgeons do not like to undergo changes, especially if it's a drastic change. In the very beginning, I can tell you again, as one of the first surgeons in the country to do robotic surgeries, GYN robotic surgeries, I had many pushbacks, and I had many people rolling their eyes and, claiming that this is just a trend and it's fashionable and it's going to die the next day and maybe a year later. And in the beginning, many people did not buy in. Starting from the finance people, the executives in hospitals did not like the investments, did not see a benefit in doing that. But I can tell you, as you dove in and you took a step in and you realize what it does to the patient, the benefits to the patients, the benefits to the growth of technology, the growth of volume, and therefore financial gain to the hospital, the benefits to surgeons that suddenly can, think of the next 20 years doing that because they don't need to be standing up in front of a patient for 5, 6 hours. They can sit down and do a really elegant, precise surgery. I think that the overall, it's a win-win situation for everyone involved.
Thank you, Dr. Asulin. Dr. Plevris, I would also like to direct this question to you to offer the additional perspective outside U.S. and in Greece. Again, the question, when you first started robotic surgery, what did you encounter, or did you encounter any barriers to colleagues adopting the new technology?
Yeah. I mean, it's the fun fact is that the same treatment, the same way of approaching robotic surgeons from the laparoscopists is the same way they were treated by laparotomists when they were trying to implement laparoscopy. The way I try and talk to my patients about that is that you don't trust the technique, you trust the surgeon. So if someone feels that he can do that surgery better with laparotomy and you trust the surgeon, you can go on and follow. The thing that I don't like, and I try to stay away from those kind of arguments, is like, when you criticize in a wrong way a technique that nowadays has spread so much because obviously it has huge benefits for the patients. So if you feel better operating with straight stick laparoscopy, just go on and do it. But don't tell me that it's better vision or less tremor, or it doesn't make any difference if you work deep in the pelvis in order to have like articulated instruments. It makes a huge difference. It's the fact that nowadays more patients opt for robotic surgery, and always, when I was trying to convince people to have robotic surgery rather than laparoscopy, I was thinking that there are still lots of people having open cuts in their tummies. So there are lots of patients out there that you can um, convince towards, my treatment. And more surgeons nowadays convert to robotic surgery, even the ones that are very experienced in straight stick laparoscopy. And I mean, I am 6'2". I could not stand my career working like for 30 years, standing in front of a screen. Yeah. So I believe that another good thing about robotic surgery is that it will help me operate for longer.
That's a wonderful addition too that you don't really think about. Just continuing on the realm of misconceptions, one of our attendees, Dr. Plevris, have asked, sometimes I encounter patients who are hesitant to have robotic surgery. There are a lot of misconceptions, like AI and robots are the ones doing the surgery. What are some ways that you can help patients overcome their fear and assure them that this is the best possible care for their case?
Yeah. I mean, I completely agree with Dr. Asulin. You have to teach the patients that a robot is an instrument. It's nothing more. So the way you use like scalpers that use ultrasound, the way that you use tripolar instruments during surgery, that's not AI. Those all are instruments. So you have to find a selling line for yourself. You have to say that it's 100% on me, or I'm standing like 2 feet away from the patient, or we're working all with bedside assistants that we work together all the time. And in fact, let them know that the more integrated AI gets into robotic surgery, the better outcomes will be there for patients. So, and in fact, that no matter what might go wrong, and it's not going to be due to AI, during summer, we had a fire in our hospital. So we had to do an emergency undocking scenario to our robot while we were operating
Oh
because there
my.
was a fire in the hospital. So in most cases, it's going to be a human error or another disaster at the time of the hospital, and we're trained to deal with that. AI, that's not what happens today with the robot. It's an instrument that increases your eyesight, that filters your tremor, that helps you operate closer to the area. In fact, when you operate standing in an open abdomen, your eyesight is like, I
Yeah.
don't know in feet, but 1 meter away from the structure that you are operating on. Whereas with the use of the robot, you're a few millimeters away. In fact, we got trained that robotic surgery is a surgery that you operate close to the tissue, whereas laparoscopic surgery used to be traditional laparoscopy, a surgery that you used to operate a bit far away, more far away from it. So you should need to find your selling line. And I think what you should say is it's if I'm 100% of me, using the robot is 110% of me because it's me with my dexterity is increased.
I like that. That sounds great. One last question from one of our attendees, just to be sensitive to time. Dr. Asulin, our attendee asked, I want to become accredited. We have an excellent robotic surgery program, but I'm having a hard time getting our hospital leaders and executives to get on board. Did you encounter similar challenges when you first pursue accreditation, and how did you overcome this?
Well, I don't think it's a challenging sell here to administrators because um, I don't see any, well, okay, you can argue that. I don't see a big downside to getting accredited by SRC. The finance people and the administrators would look at cost at the end of the day. How much money is it going to cost me, and how much more money can I make at the end of the day? And I think that you can answer both questions very easily, saying that it's not going to cost you that much in a large scheme of things. The accreditation is not extremely expensive, but the benefit is enormous. And I think that if they can, and I'm pretty sure that you guys can help answer many of these questions. I know many of the SRC folks doing amazing jobs over many years. I'm pretty sure that they can show a presentation to the executives, and that'll be a no-brainer. Now, you do need the surgeons to buy in, or you do need some pioneers or some leaders within the hospital that need to believe in that. And I think together with your story and your descriptions and the fact that it's really not a huge investment financially, I think that's a very easy argument to make. I do want to go back and just give you a few seconds, and I know we are heading towards the end of this, and I do have a couple of cases still today, but I do want to talk about robotic technology and pushbacks and or people buying in and getting more involved. As I mentioned, the process of advancing the technology, advancing the efficiency, the proficiency of surgeons and whatnot, allows us today to perform surgeries that otherwise in the past we had a difficult time completing in a minimally invasive approach. And I'm going to speak about endometriosis for 5 seconds, maybe a little longer. I do the vast majority of my work now, I do complex endometriosis surgery. For all the surgeons that are on this call that do robotic surgery and or do endometriosis surgery, I'm pretty sure that they'll all attest to the fact that that could be one of the most challenging surgery you've ever performed. Robotic surgery, when you become comfortable enough and when you do enough work and when you get comfortable dealing with distorted anatomy due to endometriosis and, challenging, surgical fields and whatnot, robotic surgery is the only tool right now that allows you to complete these very challenging endometriosis cases with great success. In the past, we used to do these cases open. If we want to do a wide excision of advanced disease, laparoscopically, I don't believe that you could, and I can tell you I take pride in being a great laparoscopist in the past. Certain cases I would not dare to complete laparoscopically, especially stage 4 endometriosis. But today, with robotic technology, we are able to tackle even the most challenging of cases, and I do those regularly every day,
Yes, I can see that. Discussion today about the value of robotic surgery, how it's advanced. I appreciate the time that you've taken as master surgeons to recognize the partnership and the collaboration with SRC achieving the Robotic Center of Excellence. I think it's also important that you discussed our designee services, and under our designee services is our quality improvement team that really helps your teams to drive outcome-based reporting that makes it measurable, as well as our marketing and communication department. I very much appreciated you acknowledging that these two services together within our designee department at SRC is what ensures the optimal success of your robotic surgery program. I wanted to just take a moment to thank both of our robotic surgeons for taking their time today. Appreciate all of our attendees. As you can see on the screen, if you're interested in learning more about the SRC accreditations, please go ahead and scan the QR code, and someone from SRC will contact you to go through your next steps. Again, thank everybody for your time. It was a pleasure to be the moderator today, and I hope everyone has a good rest of your day.
Thank you so much for having us.
Thank you very much for having us. And by the way, Sue, feel free, if any of the attendees or people that heard this presentation have any further questions and they need to reach me with anything, please feel free to share my contact. You have it, and I'll be able to help in any way I can.
Thank you, Dr. Asulin. Thank you, Dr. Plevris. We so much appreciate you both. Have a great rest of your day, everyone.
Bye-bye. Good day now. Bye-bye. Take care.